Thank you so much, Robert. It's really good to be your friend, and I think I have a lot of friends in this room. And I just want to say thank you very much to Dr. Arunas. I really was inspired by your talk and how you feel that lived experience is so important. So that's really been very inspiring. Okay. So I'm going to talk to you about the power of integrating experts by experience in transforming mental health. You probably know a lot, you heard the word lived experience, but we also call ourselves experts by experience. So I've been very creative for the images. So if we look at the power of lived experience, if we just go back a bit in the past, and I can actually, when I was diagnosed in 1991, as Robert said, and if I look now how things have changed over time, I actually seen the change. Okay, not that we're there yet, but it's there. If you look at the past, there's been a lot, mostly coercion, where people have been forced into treatment, forced into institutions, been segregated, kind of removed from your community to receive treatment or just to, especially in terms of the facilities. I think there's still a lot of facilities that you find that's quite far away from the communities. And I think we specifically called those in the past asylums. I know in South Africa, a lot of the specialized psychiatric hospitals are still kind of quite far out of the city or out of the town. And that already says to you about the segregation part. Inequality. I mean, inequality in terms of healthcare. I think Norman also spoke quite a bit about the healthcare. People also need to receive for their physical health as they would for their mental health. Discrimination, I think Graham will also tell you about that. Discrimination is caused a lot of issues. I mean, it really denied people the right to a lot of life opportunities. So has stigma. I mean, people could not obtain. I still remember when I was took to a hospital, I was spent together 4 years in a psychiatric hospital. When I was admitted that day as an involuntary patient, I was told that I had no rights from there on, that I will never achieve at anything, that I couldn't manage my own finances. So all those things, I was literally told that I couldn't do anything. And I think that's the stigma and this discrimination that also plays a role. So that has caused, of course, complete exclusion from creating change. So we were excluded from that process. So today, I think we wouldn't be here if things haven't changed, right? So today we have given opportunities. We've been given opportunities. I mean, I myself have been very grateful for being given a lot of opportunities to participate in various areas, very engagement, conferences, and so on. And that is valuing expertise, lived experience expertise. And of course, sorry, how was it yellow? Policy, policy and practice. So being involved into that process as well, policy and practice, and being seen as partners. Okay, but I must say at the same time, it's not happening completely, but it is happening. So we are being acknowledged as catalysts of change, for the most part. But we still got a long way to go, of course. So if we're involved, and the power that we bring to mental health in the broader community is, of course, producing quality services. Because quality services, if it's guided by people with lived experience, you will be giving people with mental health conditions services that they actually need and can benefit from. Equality and equity in mental health care. Dignity. Dignity is always such an important thing for me because when I was in psychiatric hospitals, it literally looks like it still looks like a prison. people don't treat you very well. I wasn't treated very well by the health staff. I mean, I literally was told I have no human rights. But for me, that had such an enormous impact on my dignity. But if you really respect people's human rights, listen to them, really provide quality care, that actually gives them dignity. It's also empowering. And then access. So what I always see the future is when we really go forward and see and promote the power of lived experience, we will see a universal unity of change. It wouldn't be the us and them, but more a unity, one united. Okay, so just to kind of explain, to say what exactly is the experiential value of people with lived experience. We have really in-depth and unique knowledge and understanding of the impact of the condition itself. Having lived through symptoms or, even medication side effects. Sometimes people think you only have symptoms, but sometimes side effects of medication have just a large impact as well. And then understanding what is needed to remove the barriers to inclusion, equality and equity, stigma and discrimination, to be free from that in communities. And also what would help to facilitate sustainable development. I think all countries want sustainable development. And if you really take care of people's mental health and it's driven by people with lived experience, you will eventually achieve that as well. And of course, to protect mental health. And yeah, I'm not talking only protecting the mental health of people who live with mental health conditions or the broader, but everyone. And then we contribute really in ways that other experts cannot contribute. I sometimes think maybe sometimes professionals are a bit threatened by people with lived experience coming into the play or the service delivery aspect. But it's important that we are not there to take over anybody's roles. We have our own expertise based on our own lived experiences. And then, of course, we are very uniquely positioned to provide cost-effective and practical solutions to promote mental health. By that, I mean, sometimes it's very pointless if you, let's say professionals think they need to implement or establish this project or this service. But what if it doesn't really benefit the users of that service? Then it's a lot of money going to waste. So the best cost-effective way is to listen to people with lived experience, what they need, what's going to help them to recovery. It's going to save a lot of money. And then we are very useful, of course, in advising decision makers, policy makers, on how to strengthen and mainstream mental health interventions into various sectors. Mental health is not isolated within the healthcare system. I mean, we are impacted by various areas. If we want to go look for employment, we experience some obstacles there. Education obstacles, justice systems. So mental health needs to be integrated into all of those sectors. Workplaces is another one, especially in terms of people who are employed in workplaces, or just people who are not necessarily diagnosed with a condition, but in the workplace are not supported with their mental health. And then to the value, which of course I said is not limited to the mental health sector, but with a long-term cost savings potential, proved outcome. So I pretty much said that already. Okay, another point I want to make on that is the other benefit of including people with lived experience is also you develop a service that is context-specific, because you can't take a service that's developed by, let's say, someone in South Africa and now try to take that exact thing and implement it in India. You need to engage with local people with lived experience to be able to make sure that it's relevant to their environments and their contexts. So people with lived experience, so we have really distinct roles, not as individuals, but also our representative organizations. There are many lived experience organizations. If I think back when I started, there were really very few across the world of service users organizations, if I can refer to it as that. And I never really heard about many. But now, as we can see the recognition of people with lived experience being integrated, you see a lot of groups starting up. And I think that is very exciting because I can see how that would be the driving change for policy and practice globally. Lived experience must also be involved based on the principles of that enhance diversity. Diversity, like in South Africa, we have a very culturally rich country. So different races, different cultures, all those things. So we always need to consider that as well. Equality and equity, and ensure the engagement is meaningful and authentic. So the principles of engagement, on the right, I listed some keywords. So that means when you engage with people with lived experience, include them in projects, include them in review of policies and legislation, you need to consider, make sure that there's mutual respect. If others respect us and what we contribute, we respect them. And also that trust that our experiential value can help change things. Transparency, any process needs to be transparent. Diversity and equality, as I mentioned, non-discrimination. It must be a safe space for people to feel free to contribute their views and their perspectives. And enhance wellness, yeah, sometimes I think for us that's an important one. In any situation, whenever you engage with people, any people, you need to make sure that space also promotes the wellness of the people, that it's not stressful, it doesn't cause anxiety, it considers all the issues. And then the valued contributions, make sure to value, and non-tokenism. Just to go back to meaningful and authentic engagement. So if we look at what is meaningful in engagement, it means you need to empower the people when you engage them. You need to give them ample time, preparation, you need to give them information, and that also comes from the transparency. Be transparent about the process. And authentic links in with the non-tokenism. So I think sometimes it's happens quite a bit in my experience with especially policies and legislation, especially when with the CRPD, the Convention on the Rights of Persons with Disabilities, when it specifically the country reports countries need to note whether they included people with disabilities, then it becomes kind of a tick box exercise, and there wasn't really meaningful and authentic. I just want to share some key strategic elements. So when there's a project or engagement being organized, just to always make sure these things are in place to facilitate that. So first of all, engagement must be included right from the beginning, right from the planning phase to the conceptualization. So when the idea is there, people with lived experience must be involved right from that point. And right to the end of implementation, also the monitoring and evaluation components. Because what we find sometimes, it's very difficult when you have a project, for example, and you include people with lived experience here in the middle somewhere. It becomes very confusing, and then it becomes an issue of people cannot meaningfully contribute because they haven't been part of that entire process. And then planning for provisions of sufficient resources, logistical support, and allocation of reasonable funds. Yeah, we kind of advocating for that issue at the moment as the Global Mental Health Peer Network. But first of all, sufficient resources, whatever resources we need, and that means financial, human resources, logistical support in terms of sometimes if you calling or inviting people with lived experience to attend a session or a workshop, they still need to have the transport, and it's not fair for them to pay out of their own to get there, or if they can't get there themselves. The reasonable funds, yeah. So as experts by experience, we're currently kind of talking about the value, our monetary value, and Claudia, my deputy CEO, will be having a session and talk on that monetary value of lived experience, where equal pay for equal work. We come across a lot of issues, pretty much a lot of places, high and low income countries, where people with lived experience do provide a service, let's say the same time and the same quality of service, but they are paid much less or not at all. So that also impacts on the value. And then also empowerment prior to the project initiation and orientation. I always use the example of, let's say, reviewing a policy or a law. I'm not a legal person, so I don't know all that jargon of a law. Okay, by now I probably should know it. But in the beginning, it took me a couple of times to really read through it and try to understand what this law is saying. And sometimes, in my experience, people have been randomly selected to review a law or policy, and not thinking that they may not be legal people who may understand those terms. So what we suggest is to have an empowerment or orientation session so you can engage with the people with lived experience, explain to them whatever you want them to review, be open for questions or clarity about that. That then becomes also meaningful. And also to be clear about the specific role of that person with lived experience, what the expectations are, what time it's going to take of them. So always have that clarity. And then reasonable accommodation measures must always be in place. I don't know if you're aware of the reasonable accommodation. You hear it in workplaces, but it also applies to education systems. But in the context of lived experience being involved in engagement or whatever, that also needs to be taken into account. For example, when you have schedule, let's say, a 4-hour Zoom engagement, that's deadly, to be honest. A lot of us, me myself, struggle a lot with concentration and memory. So my concentration keeps breaking. So for me, when I engage in a long session, I need frequent breaks. So always consider that. Also, let's say you have someone who has severe anxiety problems and you organize, let's say, yeah, for example, he has a lot of people. Also to consider that. That person may have some anxiety having so many people around. And also sounds. I can get distracted easily. I actually hear the fan of this projector, so it's just to kind of think of those things as well. But then again, reasonable accommodation must always come from the person. You need to ask the person what they need. Don't assume what they need. Considering time frames, I spoke about the policies and legislation. I don't know why it happens, but it does. Often I've had where our government would ask to review a policy or law, and then they say the deadline is in 3 days. There is no way you can actually meaningful provide contributions to something in a very short time. And also to think I'm not a legal person, which means I'm probably going to have to read that thing a few times to really get the gist of it. So that as well. And for online meetings, for example, with us, we are an international organization, so we have members across the world in different time zones. So that can be problematic as well. Let's say you have a meeting, we wouldn't expect our members to participate in a meeting that's like, let's say, 6 o'clock in the morning. I wouldn't go for a 6 o'clock morning meeting. So because also medication also impacts on you. I take a couple of hours to fully wake, so also to consider that. I want to also next go to prevent any power imbalances and the risk of conflict. Just by emphasizing that all stakeholders are equal, and by adopting the respectful and constructive conduct. Honesty, to be honest, to keep integrity, to trust, openness, fairness, transparency, and anti-power imbalances. Yeah. So, just to finally say, I think we have never been in a better space and time to build a mental health care system together, one that delivers quality care, accessible to anyone who needs it. And I think together with lived experience and everybody, policymakers, governments, researchers, professionals, it is possible. So I think we can definitely do it. Thank you.